Dr. Sandra Lee turned a modest dermatology practice in Southern California into a global phenomenon built on treating acne, cysts, and skin conditions that many people feel too embarrassed to discuss. Through television and social media, she became widely recognized for transforming skincare into something accessible and strangely captivating. Millions followed her work, trusting her with their deepest insecurities. Yet, behind the viral success and growing brand, there was a demanding pace that required constant energy, long hours, and emotional resilience that few people outside her world could understand and appreciate. A day that started like any other. At her Upland clinic, the day began like countless others with a structured flow of patients, filming equipment, and a familiar sense of purpose. Dr. Sandra Lee moved between consultations and procedures with practiced ease, addressing concerns ranging from minor acne to more complex skin conditions. Cameras recorded her work for television audiences, capturing both medical precision and compassionate communication. Nothing about the morning suggested anything unusual. She remained focused and composed, continuing her routine, unaware that her body was about to shift and change, her day entirely unexpectedly suddenly. Subtle symptoms begin to surface. Later that day, subtle physical changes began to appear, though none were immediately alarming on their own. She experienced a sudden wave of heat and a sense of discomfort that felt unusual but not clearly dangerous. Her body seemed slightly off balance, and her energy dipped in ways she initially dismissed as fatigue. Despite the warning signals, she continued working and interacting with patients, attributing the sensations to stress or exhaustion. At the time, nothing pointed medical emergency, making it easy to overlook what her body was trying to communicate. The moment things turned concerning. That evening, she went to her parents' home expecting to rest after a long and demanding day. Instead, her condition began to feel increasingly concerning. Sharp, unusual pain started radiating through her leg, making simple movement uncomfortable. She tried to ignore it, convincing herself it would pass. However, when she attempted to walk down the stairs, her balance felt unsteady and unfamiliar. Her body no longer responded with its usual coordination. Despite these warning signs, she still tried to push through the discomfort, not realizing seriousness of what was unfolding. Recognition of a medical emergency. By the following morning, the situation escalated into something far more alarming. She noticed weakness in her left hand, which seemed to lose control without warning. Tasks that required coordination suddenly felt impossible. When she attempted to speak, her words came out slurred and disjointed, creating immediate concern. As a medical professional, she quickly recognized the classic warning signs of a stroke, including speech difficulty, weakness, and loss of balance. Despite this knowledge, there was still a moment of hesitation as she tried to process what was happening to her body. The hospital confirms the fear. After being taken to the hospital, medical imaging confirmed what she had feared most. The MRI results revealed an ischemic stroke caused by a blood clot that had blocked oxygen flow to part of her brain. Doctors explained the urgency of the situation, emphasizing that brain cells begin to die within minutes when deprived of oxygen. Every passing moment increased the risk of permanent damage. The reality of the diagnosis was overwhelming, turning a moment of uncertainty into a clear and serious emergency that required immediate treatment and careful monitoring. Understanding the gravity of stroke, doctors explained that an ischemic stroke occurs when blood flow to the brain is blocked, depriving brain tissue of oxygen and nutrients. Without immediate intervention, the affected cells begin to die, rapidly leading to potential long-term impairment in speech movement and cognitive function. In her case, the symptoms aligned with multiple classic warning signs that are often overlooked or misunderstood. The experience highlighted how quickly a normal day can turn into an emergency, especially when early symptoms are subtle enough to be dismissed or rationalized as something less serious. Risk factors and missed signals. Looking back, several risk factors had been present long before the stroke occurred. High blood pressure, elevated cholesterol, and chronic stress had all contributed to a gradual strain on her health. Like many busy professionals, she had continued working through warning signs, assuming they were manageable or temporary. The demands of her career left little time for rest or preventive care. Over time, these small but significant factors accumulated, increasing vulnerability to a serious medical event. The signs present, they were easy to dismiss in the momentum of daily life. Origins: a father's influence. Her journey into medicine was deeply influenced by her father, who worked in a rural clinic in Malaysia. He often faced limited resources, relying on a single medical reference book to diagnose and treat patients. This experience shaped his determination and curiosity, eventually leading him to build a medical career in the United States. His dedication to dermatology created a foundation that would later inspire his daughter. Growing up surrounded by this environment, she developed an early interest in skin conditions and patient care. Her path would always be straightforward: the rise of a digital phenomenon. In 2010, she launched a YouTube channel that initially attracted little attention. The content was simple, professional, and focused on dermatological procedures that few people outside the field understood. However, everything changed when one video featuring a blackhead extraction went viral. The unexpected popularity transformed her online presence almost overnight. Millions of viewers became fascinated by the unusual yet oddly satisfying content. This marked the beginning of a global phenomenon that redefined medical entertainment and turned her into a recognizable figure far beyond traditional clinical practice or academic medicine. The stroke, recovery, and return. After the stroke, her life and career came to an abrupt pause. For nearly 2 months, she was unable to perform surgeries, film content, or carry out normal clinical work. Even simple actions such as walking, speaking, or using her left hand required significant effort and recovery. The uncertainty of her condition created deep concern about her future in medicine and media. Despite the challenges, she gradually began rehabilitation, focusing on regaining strength and coordination. Returning to work later was difficult as the environment carried memories of what happened to her. A changed perspective. Moving forward. Today, she has returned to her professional work, continuing to operate film and educate audiences around the world. Physically, she has recovered to a significant extent, though certain subtle changes remain in her strength and coordination. More importantly, the experience has shifted her perspective on health stress and the importance of listening to early warning signs. She now speaks openly about her stroke, not for attention, but to raise awareness and encourage others to seek help quickly. What once nearly ended her career has become a reminder of resilience awareness.